A very good evening to all of you. Myself, Dr. Prateek Garg. So we will discuss about tonsils today. So tonsils are a group of lymphoid tissue situated in the oropharynx. As you can see, this is the boundary of the soft palate, or we can say the anterior pillar. And this midline, this mid portion, this is the uvula, and this is again the anterior pillar over the other side. So these these are the group of lymphoid tissue which are situated in the oropharynx, not the oral cavity. See, the oral cavity, it ends at this anterior pillar, or we can say uvula, soft palate, or the anterior pillar. And beneath this anterior pillar starts the oropharynx. So tonsils are part of oropharynx and they are group of lymphoid tissue. Now this anterior pillar, this is formed by the muscle known as palatoglossal. How palatoglossal? Palate is this is the soft palate. You can say this is my soft palate, and here lies the tongue, which is known as the glossal. So the fibers connecting tongue and the palate, soft palate, are the muscle known as palatoglossal. And where are the posterior pillar? This is beneath this is my posterior pillar. So this posterior pillar is formed by the muscle known as palatopharyngeus, because this is the palate, part of the soft palate, and beneath that is the pharynx. So the muscle forming the posterior pillar is known as palatopharyngeus. Now what is important by examination point of view is the bed of the tonsil. So this is the bed of the tonsil, or we can say the tonsil are resting over some base, that is known as the bed of tonsil, and it is formed by two muscles. One is the superior constrictor muscle and other one is the styloglossal. Superior constrictor, which is on the topmost part of the pharynx, and comes the styloglossal, or you can remember S and S. So superior constrictor and styloglossal. Let's look at this diagram. You will get better idea about the tonsillar bed. So in the purple color, this is my complete tonsil. You can see that, and this green color is the capsule of the tonsil. Here you can see this is the area indicating the capsule of the tonsil. So beneath the capsule of the tonsil is a vein known as paratonsillar vein. Whenever we do the dissection of the tonsil while removing the tonsils, so we always encounter this paratonsillar vein running in the base, and it is one of the potent source of bleeding while doing the surgery. So beneath this paratonsillar vein, the first layer of the pharynx comes, that is known as the pharyngobasilar fascia. You can see here it is written pharyngobasilar fascia. So this is the first layer of the pharynx, which is marked here, clearly shown by the green line. This is my pharyngobasilar fascia. Then comes the muscle which is known as superior constrictor muscle, which is the main muscle forming the bed of the tonsil. And beneath the superior constrictor muscle comes the buccopharyngeal fascia. So these both green marks, the first one is a pharyngobasilar fascia and the last one is a buccopharyngeal fascia, and in between them superior constrictor muscle fiber are sandwiched. Okay, so down of the tonsil, first structure comes the fascia, then comes the superior constrictor muscle. What are the other structure? Styloglossal muscle. So this is my styloglossal muscle, and which is the nerve. This is the glossopharyngeal nerve. You can see in the yellow color, this is my glossopharyngeal nerve, and the main blood supply of the tonsil is the facial artery, which also runs in the bed of the tonsil. So we will repeat again, the bed of the tonsil are mainly formed by the superior constrictor muscle, styloglossal muscle. Nerve is glossopharyngeal nerve. The artery or the vessel is the facial artery and its branches, and submandibular gland is also from the bed of the tonsil. I hope it's understood. And you can look at the diagram of the tonsil. You can see the many crypts are there. Okay, so one of the largest crypt, it is known as crypta magna. Magna means magnified or a bigger one. So this is crypta magna, and there are other crypts also. So total around 10 to 12 crypts are there in the tonsillar fossa. Okay, 10 to 12, out of which one of the crypts is largest one, known as crypta magna. What is the blood supply of the tonsil? So the main arterial supply of the tonsillar tissue is the facial artery, and it gives branches, the first branch is the ascending palatine and other one is the tonsillar artery. So both the tonsillar artery and ascending palatine artery are branches of facial artery, which is a branch of external carotid artery. So in the diagram you can see this bigger one is the external carotid artery, and from this the facial artery is the main supply. Then comes the branches from the lingual artery. You can see in the diagram these are dorsal lingual branches. And then other arteries are ascending pharyngeal artery and descending palatine artery. This descending palatine artery is a branch of maxillary artery. From the maxillary artery, this descending palatine artery descends and supplies the tonsils. So try to remember the ascending palatine artery is the branch of the facial artery, and this blood supply is very important for the examination point of view. Okay. Now, what is the lymphatic drainage? See, the main lymphatic drainage of the tonsillar infection or tonsillar tissue is upper cervical nodes, upper deeper cervical node, which is also known as jugulo-digastric nodes. If you can see in the neck, this is my jugular vein running and digastric muscle is inserted here. Is this lymph node, this area carrying the jugulo-digastric nodes is the most common node which is involved in this tonsillar infection or tonsillar tissue.